Welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele. We're talking about a bunch of different topics. Our last topic today is blepharoplasty. I said it correctly.
That's correct.
But this is blepharoplasty for Asian eyes, correct?
Right. Yeah, because anatomically there's a few differences.
Yeah, so tell us why. What's the differences and how do you fix those?
So the Asian eyelid, it usually doesn't have as discrete a fold.
Okay.
And when it does, it tends to be lower.
Okay.
Because the attachments between the skin and that tarsus, that little firm edge at the end of the eyelid, tends to be looser or absent.
Okay.
So it allows the fat pads to fall forwards and give a much fuller upper eyelid, and also causes that epicampal fold, the little skin that comes down right next to the nose.
So are you actually changing the whole shape of the eye?
It can be, but that's not always the case.
Okay.
I mean, a lot of people like their Asian eyelids, but the same things happen with everyone's eyelids. They get full, the fat pads come forward, we get extra skin. So you can just reduce skin and keep kind of the same shape, or you can round out the eye.
All right, well, let's go right to before and after pics.
Okay.
Very interesting. First one.
So this is someone with kind of a little bit of ptosis too. The eyelids are a little bit low. So in this case, I did round out the eye. I made it a little bit bigger.
Very nice.
And also gave her a discrete fold. You can see the folds are at different levels before. The right one kind of ends early. The left one goes out farther. So afterwards, they're much more discreet.
Perfectly in balance. Did you take skin away from that?
Yes.
Oh, you did?
Yes, I took some skin and also created that fold. So there's stitches that are placed right into the skin to make it fold in that place.
Next photo?
Same idea here. So the skin's starting to come down. In some areas, it's almost down to the lashes.
Yeah, okay, I can,
it just feels heavy when that happens.
Exactly.
So people complain their eyelids are heavy. People ask, you know, are you tired when you're not tired? Yeah, nobody likes that.
The worst.
That was my entire residency. But same idea here. So nice, smooth arch on each side.
It looks very nice. Even. So you didn't take much skin away from that then?
No, it's variable.
In
this case, I took more skin.
This case
so
right here.
In this case, the skin is coming down and really resting on the lashes and starts to push them down.
And that can cause somebody's eyesight to change also if it's really bad.
It can start to block peripheral vision and the superior gaze. When you try to look up, it's like a visor. It starts to block the vision. Sometimes insurance will actually pay for it when it blocks the vision.
Oh, that's interesting.
They're not always helpful.
No, I bet not. All right, next photo.
The same idea here. So she has a very indistinct fold. Really, where the fold is up high underneath the skin. So what I've done is create folds on both sides. And this is relatively soon after surgery, so there's still a little bit of swelling, still a little bit of extra redness along that incision, but looks normal pretty quickly, I think.
Is this, a lot of people come in for this surgery?
It's a pretty
more popular now?
It's pretty common surgery, yeah.
And last photo here?
Nothing with the upper eyelid, just the lower.
Really?
So if you look at the lower eyelid, there's a bag, there's fullness underneath. And what I've done is just reduce it. And that can often be done for a younger person through the eyelid itself. From inside. So there's no visible scar.
So there's no scarring at all?
Correct. And if someone has extra skin, then we go right underneath the lashes, and then we can lift the skin up, reduce the extra skin. But,
and so what is the downtime for that surgery?
It's more about explaining what happened than how it feels. Yeah, it doesn't tend to be painful. The eyes may feel dry or tired for a few days. Usually by the end of the week, it feels pretty normal. But you'll look beat up. You may have a black eye, you'll have swelling. The incisions, especially where it goes just outside the eyelid, tends to be a little bit red and a little bit swollen. So it's more about explaining.
Yeah, but I like how you make that fold. I mean, it's really prominent. You can really tell that fold is there.
Because often it'll be several different folds, and it softens up that area, and it's just, one may be low, one will be high. And overall, since the Asian eyelids usually are a little bit lower folds, they may be 4 millimeters instead of 9, which is normal for a Caucasian eyelid. When it's that low, a little bit of skin starts to block vision faster.
Big time. All right, unfortunately, we're out of time. Dr. Mele, I always love having you here, but I'm sorry we have no more time for more information. No, I know you do. Call the doc at 925-943-6353. Check them out on the web, all the before and after pictures at drmele.com or sanfranciscobreast.com. Thank you, doctor. See you next time.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.